Hello, good morning.
My mic was off. Good morning, all.
Good morning. How are you?
I'm okay, and yourself as well as I can be.
Good, good. So for the time being, I'm going to mute you. And once everyone joins, I'm going to unmute everyone, give them the lay of
Okay.
the land, and we're going to go like that.
No worries.
So everybody, thank you for joining. I'm just going to say this once for everyone who's currently on the call. I'm going to start by muting all of you, and then unmuting as we go along. I'm going to explain how this is going to work once everybody's on the call, and we'll take it from there. So for now, I'm going to mute you all just so there's not a lot of cross.
Hello.
Hi, good morning. How are you?
I'm fine, thank you. This is Nathan Vyas here.
Hi. Thank you for joining. I'm going to mute you for right now just so there's not a lot of crosstalk, but
Okay.
once everyone's on the call, I'm going to explain how this is going to work.
Okay, sure. Thanks.
So for all that just joined, I'm Jonah with the Brooklyn Borough President's Office. We're waiting on a few more participants to join the conference, and then we're going to get started. For the time being, I'm going to mute you all just so there's not a lot of crosstalk. But once we begin, I'll explain how this is all going to work. I'm going to bring people on one by one. So for the time being, I'm going to mute you all until we have everyone we need. Hello. Who do we have on here? Galaxy A10? Hello? Galaxy A10, can you hear me? Hello? Okay. So everybody, we want to thank you for joining. If I could just have your attention for one moment, please. So my name is Jonah Allen. I am the Brooklyn Borough President's press secretary. We want to thank everyone for joining this morning to talk about the needs of ethnic communities, non-English speaking communities during this pandemic. The way this is going to work, I am in charge of the meeting, so I will be muting everyone as soon as I'm done with this and bringing you on one by one in the order in which you're speaking. We ask that you keep your remarks to about 1.5 minutes, 2 minutes tops, just, because we have a pretty robust speaking order. So that's the way it's going to work. Afterwards, we are going to open it up to questions from the press, if we have any. And then we will conclude. If you're having any issues with your audio, you can private message me just to ensure we're keeping the flow of things. But otherwise, we're going to begin. First, we're going to bring up the host of this press conference, and that is Brooklyn Borough President Eric Adams. One moment.
I thank all of you who are joining us here today on this extremely important topic. When we look at the fact that we have had over 63,000 cases of coronavirus with over 1,900 deaths in New York City, I believe that it is imperative that the city and state speaks to the entire city. Just looking at Brooklyn, New York, where 47% of Brooklynites speak a language other than English at home. We cannot continue to speak in an echo chamber. Not every resident listens to a briefing from the president, the mayor, or the governor. They receive their information from different outlets. Coronavirus is not an English-speaking virus. It is a virus that is hitting all of our communities. And we have not seen a robust outreach in the various communities in the city of New York. I'm calling on the mayor and the state to allocate a funding stream that will advertise in local papers, local ethnic radio stations, local ethnic cable programs, as well as having a mailing of information to households to give basic tips such as hand washing and how to go about fighting the coronavirus issue on two fronts. I have stated repeatedly that the fight for coronavirus, to defeat coronavirus, must be fought in our hospitals, in our healthcare facilities, where individuals are already diagnosed with the disease, but it also must be fought on the ground in our communities where we can prevent people from either catching the disease or spreading the disease. And in order to do that, we must become communicative. And that is not something that we're seeing at the current time. I have received a number of communications from the diverse groups in our borough and throughout the city that have clearly stated that they do not feel they are being informed at the right manner. We have a large Korean population, for example, where they do not speak English at all. And they are watching the networks and the stories and the information being disseminated only in English. We look at the Borough Park and Hasidic community, where I have a large Hasidic community in Borough Park, Crown Heights, Williamsburg, where many of the residents don't look at TV, English-speaking TV. They don't listen to English-speaking radios or newspapers. They receive their information through alternative methods, and many speak only Yiddish. If we do not tap into those groups and speak in the methods that they communicate, then we're losing a large population. I was in Canarsie a few weeks ago, and I saw a group of young people. They were playing basketball in NYC. And when I told them that they're supposed to be practicing social distancing, they replied by asking me, what is social distancing? And it's real that we believe we are talking to everyone when in fact we are not. And so it is imperative that the city and state become intentional about reaching out to the various ethnic newspapers, radio stations, cable shows, and also methods of communications. Speaking to our rabbis, our imams, our Baptist and religious leaders, our Sikh temples, bringing them into the methods of communicating and to ensure that everyone receives the proper information, the proper guidance, and the proper tools on how to deal with this very real disease that is going beyond the boundaries of a particular community and reaching throughout our entire state. Lastly, it is important that the governor and mayor get on the same page. We just had a new mobile testing site, drive-through testing site open in the Bronx. The second one, we have one open on Staten Island, yet we have no drive-through testing site in Brooklyn. The only one that we have that Mark Traeger, the councilman, was able to get was closed down. The Department of Health and Mental Hygiene is telling us no longer to do testing, but the state officials are stating we should be doing testing. We're in one state, there should be one message, and that message should be translated to all of our communities. The lack of a unified message and the lack of sending that message to all groups based on their language and structures in their community is going to be harmful to the diverse population of the state in general, but specifically the city of New York. I believe it's no surprise that we're having these large cases in Elmhurst Hospital in Queens, which is one of the most diverse places, not only in the state, but throughout the entire country. How much have we done in Queens to speak on the ground with the various ethnic groups and the various languages that are spoken there? Same as in Brooklyn, the two largest population of coronavirus cases are showing up in Brooklyn and Queens. Yet far too much attention is being played in Manhattan instead of the outer boroughs. We have no information about the new testing procedures or the new treatment of using different methods. They appear to be only in Manhattan and not in the outer boroughs. This is not a Manhattan disease. This is a disease that has impacted our entire city. Any new procedures to treat coronavirus should go to the epicenters of coronavirus, which is Brooklyn and Queens. We need to ensure that the message of treatment, prevention, and access to quality health care is given to all of the members of this city, no matter what language, no matter what community they are in, and no matter what their economic status is. The recent map that was released and showed the number of cases of coronavirus clearly shows that the poorer communities are having a disproportionate impact. And those poorer communities are the same communities where there are various languages that are spoken. It is time for us to act now to decrease the amount of exposure to the various communities of the city of New York, and that is all communities. So I thank all of you who are joining us from the various ethnic groups in this city and part of the emerging immigrant population that contributes to this city greatly. You should receive the same level of service and protection, no matter what language you speak, no matter what community you are in. Thank you.
Thank you, Borough President. Next up, we are going to hear from Mo Rosvi from the Council of People's Organization. Mo, go ahead.
Hi, everyone. Assalamu alaikum, everyone. Also, thank you so much, Eric. And, it's always when we make a phone call to you and you step right in to help us. And it is imperative, the steps that you have taken at the moment, because yes, it is true. Our communities are not getting the information in their languages, and we need to make sure they do get it. And all the news media that's on this call, I urge you to disseminate the information, and COPO itself is going to help you to get some sort of resources for at least this moment so you can disseminate the information. I know all of you are having a difficult time. And also, I want to reiterate what our borough president is saying, because we need to be united, and Brooklyn is going to be strong. And that's the message. We are going to stay together. We're going to make sure we're going to get through this. And adding to this, we also have to disseminate the information for the small businesses so they can survive this disaster, because many of our shops, they're going to shut down and they're not going to open up. And we are so concerned about that, especially in Brooklyn. Every enclave in Brooklyn or ethnic community has a little niche. I mean, little Pakistan, little Bangladesh, little Korea, little China. They all are distressed and they're worried. So we definitely want to stay together and be strong. And all this information, I would request Jonah to, send information, especially the small business information, to this ethnic media. And we will also get funds from our board members, our private donors, to assist this ethnic media. Thank you so much.
Thank you, Mo, for those words. Next up, we'd like to bring up Anu Joshi from the New York Immigration Coalition to say a few words.
Hi, thank you so much, Borough President, for hosting this call. We definitely want to underscore the need to ensure that services are available in language, both by the city and by the state. I wanted to highlight a couple of resources that the New York Immigration Coalition has on our website in 9 languages. We have resources relating to health services and how immigrant communities can access the healthcare that they need in this moment of crisis. We have daily updated information in 9 languages about access to education and what immigrant families need to know to ensure that their children are continuing to receive an education, are able to access 3 meals a day through the school food sites, are able to access the regional enrichment centers. If you or your family member is an essential worker, you can qualify to send your child to a regional enrichment center. And we have all the information you need to be able to do that on our website in language. We also have information about all of the changes that are happening in immigration court. We know that the courts have been opening and closing, and USCIS offices have been closed. And so we want to make sure that immigrant communities know exactly where they need to show up, where they should stay home, and how they can file for extensions. We also have information about a number of other things like legal issues, social services, civic engagement, all available in language. And that's all at our website, www.nyic.org. We will also have information about the federal relief package that passed a week ago, and how immigrant communities can and should take advantage of what they're eligible for in order to help them get through this hard time. We join the borough president in urging the city council, the city and the state to ensure that all communication is happening in multiple languages, to ensure that all of our communities are really able to know and understand what's happening and to take advantage of services that are being offered. So thanks so much for hosting this call.
Thank you so much. Appreciate it. Next up, we are going to hear from Hafida Torres. She is with the Moroccan American Women's Association. Hafida, would you like to say a few words? You're on.
Okay. Yeah. Assalamu alaikum, everyone. Thank you, our borough president, for hosting this meeting, and thank you for your concern about our ethnic group and our community to get the information, the right information they need. So in terms of me, I'm Moroccan, I speak Arabic, and I've seen a lot of confusion in the community, in the Arabic community. What they do, they just spread the word between them. One knows, the other one does not know. One wants to show off that he knows or she knows. They give just false and fake information. Oh, the president say that, Dr. Fauci say that, you know, and the information goes and spread from mouth to mouth, fake information. And the people, they're not, when they have a lot of confusion, they don't trust anyone. They do what they want to do. So what they do, and especially in our community, and you know, the religious communities, when they say, oh, God is going to protect me. Yes, God is going to protect you when you think about others to protect others. So God is going to protect you, but he sent you the message to stay home, to be careful. So they don't understand all these things. So it's a lot of miscommunication in between the community. So if we can get the right information, the right message in the same language and the same dialect, it would be easy for us to stop this spread and make people understand that they have to stay home, they have to wash their hands, they have to be careful. And even in terms of the religious part, our religious leaders, they can give some, you know, like lectures, small, in the same language, telling people that does not have to do with religion, politics. This is a concern for everyone. It's a matter of death, life and death. So you have to be careful. So I thank you again for taking this initiative. And I want to say that in our community, we have only one radio that disseminates the information, that hosts, and it's located in Philadelphia. It's a Moroccan small business. He started on his own, and now he's doing the COVID-19 information for the Arabic and the Moroccan, specifically for the Moroccan community. And we have only one newspaper in Queens, as Arab Astoria, to disseminate and to give that information to the Arabic speaking. So if we can get more, and you're talking about the funding, it would be very, very helpful for the community to get the message, the right message, and to follow the guidelines, the president guidelines. And thank you for hosting this. Thank you so much.
Thank you, Hafid. Appreciate it. Next up, we would like to hear from Xenia Barnes at the Melquan Jatel Anderson Foundation. Xenia, if you'd like to say a few words.
Yes. Good morning, everyone. Thank you, Borough President Adams, for hosting this. This is truly important. I definitely would like to echo everything that you said. This virus is not race-based. It's also not community-based. It is very important that we disseminate this information via all languages because, again, New York is a diverse place. However, we also need to reach our youth because youth are not taking it as serious as they need to. They're still going outside and they can be carriers and they're bringing it back home and passing it amongst their family members, those who do not have strong enough immune systems to fight something like this. So we have to find a way to really hone in and get this message to our youth so that they too can understand the importance, because right now they're seeing it as schools are closed to the 20th. It can't be that serious if on April 20th the doors are just going to open back up and we go back to school. So they're not taking it as, they're not being as conscious or as aware. And then as adults, we're also thinking that they understand everything. So it's like, yes, like you said, social distancing. We took for granted that our youth all understood what that was and how to practice that. So we have to make sure that, yes, we are sending the information out in all languages, but we have to come together and figure out how do we get our youth to understand this, to the impact that it has and how serious it is before it hits so close to home to them, because that's when they're, sadly to say, that's when they begin to understand it, when it hits close to home to them. To close out, the MJF Foundation would just like to thank all first responders and essential workers. We recognize your selflessness, we recognize your fear, but we admire your strength for getting up every day and doing the things that others cannot, and putting others' well-being before yours and your families, because that's what they're doing. They're stepping up when others cannot. Thank you.
Thank you, Xenia. We appreciate those words. Next up, we would like to bring up Yasmin Atef from the Yemeni Women's Association. Yasmin.
Yes, hi, good morning, everyone. Thank you so much, Mr. Eric, for posting this. And yeah, today, as we see, we are in War 3 with COVID-19. So we all want to be together and against this. So if you go to Google and search about New York ethnic map, you will see Mexican, Chinese, Pakistani, Arab, from all different immigrants who doesn't speak English. Some of them they speak. So New York City is home to, as mathematician, is 3.1 million immigrants who speak different languages. And in this crisis, we need different languages to direct and, you know, tell people to update with the COVID-19. So when this crisis started, I was thinking, what should we do, like to direct people, I mean, who doesn't speak their language. So from my side, I just created a Facebook page. I just called some teams on the US Arab radio as Arabic, and I want to translate every word that our mayor said, that he posted every day. We need to translate it to different languages so people will understand. We will be all together and help with this COVID-19 to get over it. So we really need this. We need like what they call it. We need the ethnic media to tell people and educate and the new roles that about this crisis. So we will want to be all together and help each other in these days. So thank you so much again for everyone and for hosting this. Hopefully, like we will, like in May, everything will be as normal and everything will be back. This is only if we come all together as one hand and help each other. So we are in New York. Hopefully we'll be safe next month. Thank you so much.
Thank you, Yasmin. Appreciate it. Next, we'd like to hear from a community leader, if he's still on the call, Mr. Anthony Beckford. Anthony, if you're on the call, feel free to unmute yourself.
How's everybody doing? Good afternoon. Thank you for having me on this call. Thank you for putting this call together. Yes, I basically, concur with everybody has to say, like, this is a very serious matter. We need to get past the disinformation that's out there and try to put out more of the truths. In the matter, I was just doing a Facebook Live just recently, and people were asking me, about the factor of, well, will this cure it? Will this cure it? And we need to get more healthcare professionals to be able to put out more information out there. We need to increase the platforms to be able to do that. We need more electeds to be able to do that as well too. We also need to make sure that in one way or another, that the information that is sent out, say when we're sending out information on the census, we need to do that as well too, digitally, through mailers and so forth. In regards to the youth, we definitely need to find a way to get more influencers to reach out to the youth to make sure that, they actually give them this message. Because right now, there's many elders that we know in our community, especially in Flatbush and Flatbush, that are on ventilators at, Kings County and downstate right now. And, it's a reality. It's a very real reality for us. And we need to make sure that we push forward, especially within our communities, but also have the communities work together, even through social distancing, to actually, help each other out in a time of need. I know there's a lot of mutual aid networks out there. I commend them on the hard work they're doing. And same as with the first responders and so forth, so I just ask us to, basically come together even more during this time of social distancing to put more work out there to get things done. If there's more masks out there, if there's access to it, let others know so that way we can get it to those who actually need them. But again, thank you to the Borough President and the staff for putting this together. And I wish everybody, good health and safety going forward.
Thank you, Anthony. Appreciate it. Do we have a representative from Muslims Giving Back on the call? If so, they're welcome to unmute themselves and say a few words. Anyone from
Hi, I'm
Muslims?
Sunil Hali.
There you go. Hi, Sunil. How you doing? You're
Good.
unmuted.
Thank you, President Adams. As always, you are the true leader and taking this initiative amongst some others who are coming with real solutions. This is certainly one of them more appropriate for New York because of the multi-ethnicity. I am the promoter of multi-medias for my community, which is South Asians. And we cater to Indian, Pakistani, Bangladeshi, Nepalese, and Indo-Caribbeans. We have the largest radio system. It's the largest radio network. It's on terrestrial and all kind of apps, including live streaming. We have multiple newspapers, which are in language and also in English, but highly consumed by my community, since it gives them direct news about them. I feel this initiative is very, very important, and we have been doing a show already on our radio called Voices, where we are bringing experts, panels, discussions with a question answer. But mainly, what I have understood after attending many of them, it is about a lot of fears and rumors. It is about getting true help, and it is also knowing about from where we can get the real support. These are the three parameters which are playing in our minds, including me. So I'm no different than many of them, more than 1 million around us from at least the South Asian community. We have done panels with doctors, public servants, policymakers, spiritualists, and pharmaceuticals. These are the people who are, for now, helping our listeners who are in excess of thousands for now who log in through a call and also through radio on our Facebook and our newspapers. We are also creating a panel, which will be our panel where we will have experts, volunteers, doctors, pharmaceuticals, food providers, leading NGOs who are talking to us to volunteer survey, just like you started the initiative in combination with direct fresh. We have a lot of them in our community, food suppliers who are willing to provide food to everybody, regardless of their race or their ethnicity. Counselors and policymakers will create a panel soon now so that people can write their questions to them and get the answers, because the time ahead is going to get more difficult. We need to get true help and remove the fears and stop the rumors. Thank you once again to all of you. Thank you to President Adams. Sunil Hali.
Thank you, Sunil. Finally, we'd like to hear from Shahana Masoom, Sister Shahana Masoom, if she's on the call. You can unmute yourself. Are you on? Okay. In that case, we are going to move to the Q&A portion. I'm going to unmute the Borough President. We have a question coming in from Manzoor, who wants to know, is ethnic media, how do you help ethnic media during these difficult times to continue serving their communities?
I believe that our call today and a letter we will be sending to the governor and the mayor, that one, we should allocate a fund, a sum of money to advertise on ethnic radio, ethnic newspapers, and ethnic cable programs. As I move throughout the city and the borough, I know that the various ethnic communities, they communicate through their networks. Number one, the language that is spoken, as well as the forms of media that they are used to. And these various forms of media can be used for instructions, give information about the small business loans that are available, as well as medical and health care. Even the announcement that came over recently telling all New Yorkers that they should wear some form of face covering, either a scarf or some form of cloth. That information should have gone to all of our ethnic communities, and we could do that through our ethnic media. I think there must be a designated fund allocated to the ethnic media to be intentional about reaching their readership or listenership and their population.
We have a question from Jaya. Jaya, do you want to ask your question?
Yeah, hold on. My question is from Borough President Eric. There are still subways, there is no social distancing is maintained. So what are we doing to maintain that? Because there are a lot of crowd and those who are into daily wages, so they are going to work, but there is no social distancing. So why can't we stop subways for some time so that, till the time this COVID can be cured?
Yeah, it's so important, and there have been many conversations about do we shut down the city completely, as Public Advocate Jumaane Williams has called for, or how do we make sure that we still provide some of those basic essential services? COVID-19, the highest level of fatalities are among those with pre-existing conditions. 94% of the people who die from COVID-19 are dealing with pre-existing health conditions. And so if we close down the city, that population, senior population, still must receive some of the basic services, from food to medicine to other care, that many of the adult daycare centers that were providing a service for them no longer exist now. So we are, number one, calling on the governor to reshape the adult daycare centers so they can provide a greater needed services for our seniors. Then expansion of telemedicine and telecommunication like Zoom or WebEx and other type programs, Skype, that we can utilize better. And then target some of those areas where people are not following social distancing. Because how good of a job have we done to actually let people know what that actually means. There were several houses of worship where people were still going in and in close proximity to each other. So we must get that information out, and then we must do a light enforcement. I don't believe we should have the police department having a heavy-handed level of enforcement. We should do a light enforcement to remind people and to encourage people to participate in social distancing.
Thank you so much, and it's a very good, the initiative has been taken from you, and because I'm from the Punjabi TV channel, and it's a Punjabi network, and everybody, it's very right, so people wants to know in their own language so they can understand. There are many people, they don't even read English, they can't even speak English. So it's it's a very great idea, great initiative.
Thank you, Jaya. We appreciate it. Thank you. We have a question from Mr. Abu Tahir. Mr. Tahir, do you want to ask a question for the Borough President?
Hello. This is Abu Tahir from Time Television and Bangla Patrika, which you visited many times. My question is to tell everyone, not only the Borough President, there's a sad days for Bangladeshi community, which is we lost about 60 people within 2 weeks. Today we lost the President of Bangladesh Society, which is which represent all Bangladeshi living in New York and United States. He just lost his fight by coronavirus at about 4:30 in the morning at Almost Hospital. So it is a very difficult time going through our whole community, and the whole community is devastated and sad about the loss of their beloved one. As I told you, about 60 people has been, died by the coronavirus. As a community, journalist, we are serving the community last 25 years. We have a 24-hour TV channel and also the weekly newspaper, which you visited as well. But the thing is that we never have that kind of challenge in our life. All the business has been shut down. All the advertisers, they're not in the business. So we are almost run out we are almost shut down the business because there is no way we can continue, because there is no other source we can get money from the people except our advertiser. So my question is, in order to survive and serve the community, because still we are continuing the service every day. We have about 3 shows in our TV, and we are doing our online publication to serve the community and give them advice what they're supposed to do. Do you have anything in your hands right now which you can provide the service and feed the ethnic community? It's at the Brooklyn and other places.
No, the Borough President's Office, we do not have any resources to do that, but we believe on the state and city level, there should be, as I indicated, an allocation of funds that will go directly to the various ethnic media in the city, and that is our call from the governor and the mayor's office to reach out and provide this important service. So this is not a handout. It is a much needed communication that must take place in our various ethnic communities. And that is why we're reaching out to both the state and the city to do so.
Thank you very much. We have a question coming in from U.S. Arab Radio, and they want to ask the Borough President, are there available supplies now for masks and sanitary products as they have been unavailable in Brooklyn? Is there any update?
Yes, the Department of Health and Mental Hygiene, in connection with the announcement that came from the federal government that all masks, such as surgical masks and N95 masks, should be used by hospital personnel only. I had a conversation with the Commissioner of the Department of Health. They're going to hand down a written ruling to give a better explanation of that, because it seems to be, excuse me, a little unclear at this time that it appears as though that we're also talking about police and first responders. And so we're trying to get clarity on that. But we believe also that if individuals can't use surgical or N95 masks, that using a scarf, using it the correct way. I asked the Department of Health to give demonstrations on how the scarf should be worn, what is the proper way to do so. Some people are only covering their mouths. Some people believe that they should cover their mouths and nose. So we need a clearer explanation of that. The governor announced several weeks ago that those who are in correctional facilities upstate through Conf, they are making hand sanitizers. Since Brooklyn has one of the largest population and New York City has one of the largest group of people who go to those correctional facilities, we believe that we should have a large amount of those hand sanitizers distributed throughout our various community, and that is one of the communications we're going to do with the governor's office as well to get the hand sanitizers here. Assemblywoman Latrice Walker raised that issue yesterday on a call, a briefing call with the governor's office, and we're waiting for communications on how do we get these hand sanitizers here. And so in the area of masks, the city is moving away from having everyday residents use masks. They want them to use a scarf, but hand sanitizers, we're trying to get a bulk of hand sanitizers here inside the city.
We have a question from Carmina Fonseca from El Correo. Carmina?
Yes, hi, good morning, everyone. Thank you, Borough President, for this conference call. So basically, in talking a little bit about what everyone has been saying about the essential information given by our ethnic media. In our case, we have provided much information through our websites. However, there's this part of the population that relies more on print publication, and we are struggling right now to print publication. So I was wondering what in those resources that you're looking for, how it could help, print publications like ours first of all, stay alive and keep reaching this population. I was talking to my publisher, and we're willing to do door-to-door or mail to certain zip codes, but it all depends on the finances. So I was just wondering how this is part of that allocation that you're looking for.
Yes, that's exactly what we're looking for. We believe that this funding stream should go to publications like yours so that we can give a real on-the-ground interaction, communication, door-to-door mailing, writing in the languages that people understand, because as one question was raised earlier, one speaker stated, from my understanding of moving around the city to various ethnic groups, there are large populations of people who only read their papers or listen to their shows in their languages. And we're missing that entire population if we don't become intentional about getting that information. So your publication is exactly what we're talking about when we state that we must put resources to allow you to get the message out.
Folks, we're going to do 2 more questions. If there's anything that we don't get to, we encourage you to reach out. My email is available, but I'll make sure that I read it out to you in case anyone has any follow-ups questions. Right now, we want to hear from Mohsin Zahir. Mr. Zahir?
Mr. Borough President, thank you very much. Believe you me, you are the first government or elected official who think about ethnic media, not thought about the ethnic media, but going to take some actions by writing a letter to the governor and the mayor. And both of them, we know, are very busy in this challenging time. We would like you to please follow up your letter, because as some of my colleagues said, media needs support right now. So that would be great if you can follow up with the governor and mayor's office. Second, can you give us some idea how many confirmed corona cases are in Brooklyn? And when the testing sites is going to be reopened in Brooklyn?
As I stated, that there is a lack of real understanding when the testing sites are going to reopen. The governor's office is in support of testing locations, and I believe he reported today that there's some conversations around rapid testing, and we're hoping that they use areas like Queens and Brooklyn, which are clearly, both of them are considered to be the epicenter of coronavirus here in the city of New York. And so it is our hopes that these testing sites, if they're open in Brooklyn and Queens, would be open immediately. It's unfortunate that they have 2 sites that have opened in the Bronx, as I indicated. One site is open on Staten Island. We've closed the only site that we've had in Brooklyn, and that is really troublesome for all of us. And as I speak with you, I'm looking at the numbers now from my team, and Jonah, if you have it readily available, that would be very helpful. You could tell us also.
I will. It seems as though the latest numbers, there are over 16,000 cases in Brooklyn as of the latest reporting. 16,488 is the current number. That number may be updated based on the governor's briefing today. Thank you for that question, Mr. Zahir.
And there has been a steady increase, as I'm looking over the numbers now, from going back for the last few days, the numbers have increased. Going back on March 29th, we were only dealing with 8,451 cases, and now up to date, we're up to 16,000 cases. Brooklyn is about 27% of all cases in New York City. So the numbers are substantially high for the borough, and if they continue to grow, we're hoping that the numbers don't. We also want the city and state to turn over the testing data. How many cases are we testing in the boroughs of particularly Brooklyn and Queens, where we seem to have the largest number of cases?
We're going to take one more question from Majid Jaral. Mr. Jaral, would you like to ask your question?
And first of all, this is a very good step to spread information, to give awareness peoples in their own languages, I mean in their mother languages. So I want to like to start. I am also one of those people who cannot speak English very well. Definitely at some stages, I also feel difficulty to understand the message given by this conference, this session. So I also have a request, if anybody from my community, from Pakistani community, like Mohsin Bhai is here, Hassan Bhai is here, if I speak and if I cannot give a message, that doesn't make a sense that I have a request to them to make translate it. So I, first of all, beside this COVID-19, the people also getting the psychological problems. If they get fever, like any other reasons, they get psychological pressure that, oh, they have COVID-19, they affected by the COVID-19. This is just because of the fake news. Is any platform in borough office who can handle the people to give awareness to them that that can save them from such fake news? Secondly, as a journalist, I'm also representing here PNN, Pakistan News Network, and Pakistan News Network is a part of Pakistan News, which is one of the famous old newspaper in New York. Not only New York, in other states also this newspaper is published. So as a journalist, I also need correct information to give people. Being a press secretary, would you give us true information about COVID-19? Any instructions by email, by any other forum? Do you have any in your plan? Do you have any plan to spread or to convey true information to the journalists so they can pass to the people in right form? Is it?
Yes, and that's a great question. We have a document with basic information around COVID-19, and we're going to update that to talk about the recent announcement for everyone to wear a scarf, and with the CDC's, the federal government, and the Department of Health and Mental Hygiene's position on wearing surgical masks. We'll update that and we'll send it out to you. And if you want to translate it into a particular language, feel free to do so, and we will give you as much information as possible when we receive it. We currently do a briefing document every day when we get information from the state and the city. We can also send you that as well.
So everybody, we have to wrap up, unfortunately, but we want to thank you for jumping on this important call and talking about the needs of ethnic communities during this challenging time. I have one more request for everyone. If they can turn on their cameras, we would like to take a screenshot of this entire Zoom conference to really showcase the diversity of this borough and of our communities throughout New York City. So if everyone could just turn on their cameras or make sure they're on, we'd love to take a screenshot that we can post to social media that, you know, just emphasizes that we're all in this together. And again, we want to thank you. If there were any questions that you had that were not answered over the course of this call, we encourage you to, you can email me. My email, I'm going to read it out now, is JONAH.ALLON@Brooklyn, spelled out, and then B as in boy, P as in Peter, .NYC.gov. And again, we want to thank you for joining us, and have a great rest of your day, and please stay safe. Thank you all.
Thank you. Thank you, Jonah. And thank you all of you who joined us.
Thank you.
Bye-bye.
Thank you, everyone.